Okay, hi students, this is a trauma patient assessment, just an example of how to do one so that you can watch and learn and follow along if you like, or rewatch it and kind of remember what you may have forgotten while you're practicing your patient assessments. So Talmage is going to be my patient, Monty's my goose today, he's my wingman, and so we're just going to run through a trauma assessment. Okay, so I have on my BSI, the scene appears to be safe, the MOI is a fall. I have one patient. I will call for ALS and I'll consider the spine. My general impression is of a 22-year-old male and he's in the supine position. He appears to be breathing. Hi, my name is Rachel and I'm an emergency medical technician. May I help you?
Mm-hmm.
Okay,
yeah, please.
Monty, will you hold the head of my patient because he's a trauma patient and I'm concerned about that. Just keep his nose in line with his belly button and don't let his head move back and forth unless, don't let go until I tell you, okay? Tell me what your name is.
Talmage.
Talmage, What year is it?
It's 2020.
2020, and where are you right now?
I'm at C-Tech.
Okay, and can you tell me what happened, Talmage?
Yeah, I was on a ladder. I was changing some tiles on the ceiling there, and I fell.
You fell off the ladder?
Mm-hmm.
Okay, all right, so maybe you fell, it looks like maybe about 9 feet, 10 feet?
So I was at the top of the ladder for sure, yeah.
Okay, maybe even a little bit more than that.
Mm-hmm.
Okay, so my patient is alert and oriented ×4. He has an airway because he's speaking to me. I'm going to apply a pulse oximeter just to see what your room or what your pulse ox is with room air. So I'm just going to put that on your finger, Talmage, and we'll just kind of see what your oximetry is. You can rest your hands there. Okay, and we're going to see that Talmage's pulse oximetry is 90, and so it's a little bit low. So Talmage, and you're having a difficult time breathing? It looks like you're having a hard time breathing.
I am, yeah.
Yeah, okay, so I'm going to give Talmage some oxygen. So I'm going to put him on 15 liters of oxygen by non-rebreather mask. Okay, scenario, right?
Yeah.
Okay, so I'm going to give you some oxygen, non-rebreather mask for the difficulty breathing, and your pulse oximetry is just a little bit low. So we're going to take care of that, okay? And we can stop that there. Oh, it's counting your heartbeat. All right, there we go. All right, Talmage. Let's see. And I just totally got lost. So I know, but I'm trying to think if I'm going to check your skin CTC. This is what happens. You got to think through stuff. So your skin CTC looks like you're pretty pink, you're warm, you're dry. So that's really good. I don't see any bleeding at this time. So, okay, those things are good. And let me check your heart rate. Your heart rate's kind of rapid, feels a little bit weak. So you might be showing some signs and symptoms of shock. So I've already started treating you for shock by giving you some oxygen. I'm going to consider treating you for shock again later as we go through this, okay? But you're kind of pink, warm, and dry, so I think you're okay for just a moment, okay? Talmage, can you tell me where it hurts the most?
Yeah, I feel like my right leg, I'm trying not to move it. I don't know what's going on.
Your right leg? Mm-hmm. Okay. I'm just going to check that out. I'm going to just palpate down your leg. Is it your upper leg or your lower leg?
I think the lower part of it.
So tell me if anything hurts here, right there.
Mm-hmm.
Okay, and I've got a little bit of blood on my glove. I'm just going to expose this, okay? I'm going to try to be careful and not hurt you too much. And yeah, you've got a big open wound that's bleeding right there. So I'm going to grab my dressing. It's pretty bad. Yeah, it's pretty good. So I'm going to aseptically take dressing and apply some pressure there. It might hurt, Talmage, okay? But I've got to stop this bleeding, okay?
Yeah.
So what I'm going to do, apply pressure, my dressing, and I'm just going to wrap this wound, okay? Just going to hold your leg up here so that I'm not moving you around too much, okay?
Okay.
I'm just going to bandage this wound until the bleeding is controlled. Okay, and it looks like the bleeding has slowed down. Looks like it's controlled there, so that's good. While I'm down here, Talmage, I'm just going to slip your shoe off, okay?
Okay, that's fine.
Well, you put your shoes on tight. Yeah?
I don't know what to tell you. Monty said the same thing. Maybe I need new shoes.
Well, I got 5 kids. I'm an expert at like putting shoes off and on, so we're good.
See, that's how it's done right there, Monty.
There we go. Okay, I'm just going to check your pedal pulse.
Okay.
You've got a really good pulse there. Talmage, can you wiggle your toes for me?
Yeah, I think so.
Pull your toes up to your nose. Good. Push my hand away. Good job. Okay, what am I doing?
You're squeezing my big toe.
Okay, good. So you've got good pulse, motor, and sensory in that leg right there, and bleeding's controlled. Talmage, I'm going to touch you from head to toe.
Okay.
I'll change my gloves because I'm all covered in blood now, but not anymore. New gloves. I'm going to touch you from head to toe. I need you to tell me if anything that I touch hurts, okay? I'm just going to look for any other life threats, okay?
Yep.
So I'm going to start at the top of the head. Everything's good there in the head?
Mm-hmm.
Okay. I'm just going to kind of palpate down your neck there. I'm just going to feel all the vertebrae in your cervical spine. Everything feel okay?
Yeah, I think so.
All right. While I'm up here, I'm going to check your face and your eyes, ears, nose, and mouth. I'm just looking for a decap BTLS. Talmage, can you open up your mouth for me? Okay, good. Can you just like swish your tongue around, make sure all your teeth are in there? And okay, good. I'm just going to look in your ears. I'm looking for battle signs and raccoon eyes. I'm just going to check your eyes out while I'm right here. Close your eyes. Open. Close. Open. Good. And I'm looking in the nose. I don't see any trauma. I don't see anything wrong right there. So I'm just going to move on. I'm checking out your neck, and I don't see any JVD. Your trachea looks like it's in line. I'm going to palpate your clavicles. Everything feels okay there?
I think so, yeah.
Okay, I'm just kind of checking your shoulders. I'm going to press on your sternum. You make sure you tell me if anything hurts, okay?
Okay, I will.
All right, and I'm checking your rib cage. Talmage, can you take in a deep breath for me? Release. Okay, another deep breath. Release. Does it hurt to breathe at all?
I think the oxygen's helping me.
Okay, good. I'm going to palpate your abdomen. Your belly button's right there.
Mm-hmm.
Okay, I'm just going to palpate. Tell me if any of this hurts.
Okay. You feel my belly button. It's impressive.
Okay, I'm going to feel your hips. You have any pain in your pelvis?
I don't think so.
I'm going to kind of push in and down on that iliac press there. You're good. I don't have any reason to check genitalia. If I did, I would do that. You don't have any pain in your pelvic area?
I don't think so.
Okay, I'm going to palpate and feel your other leg. Everything's good there on that other leg?
I think so.
You already did your pulse, motor, and sensory in that one leg. Let's check this one out.
This is really that difficult. I put them on and take them off every day.
Good. Check this side again anyway. Your pulses both feel really good. Okay, go ahead and pull both of your toes up to your feet up to your nose again, and then push my hands away. Good. Okay, what am I doing?
You're scratching.
And now what am I doing?
Tapping.
Okay, good. So you've got good PMS there. And come back up and check your arms and your shoulders. Still nothing else is like hurting you right now? Okay. Good. Check your pulses. Feel really good. Can you squeeze my fingers?
Yep.
Really tight. Really, really tight. Good job. Okay, what am I doing?
You're scratching.
And what am I doing now?
You're pinching.
Okay, good. So you've got PMS in both of your arms. So that would make PMS times 4. And with the help of my partner, I'm going to log roll my patient towards me, away from that injured side of the body. And I would have another partner help me to log roll. So Talmage, I'm just going to roll you up towards me, okay, on my partner's count of 3.
Count of 3. 1, 2, 3.
Okay, I'm going to palpate the spine. I'm going to start at the cervical spine again, just make sure I didn't miss anything. And I'm just walking down your vertebrae, feeling for step-offs and any decap BTLS. I'm looking at the back. Talmage, make sure you tell me if anything hurts back here, okay? It's really important.
I don't think it does. Nothing so far.
Okay, so I'm just going to expose and make sure that I didn't miss anything on the back. And because of the injury, I'm just going to go ahead and put him on a backboard just for moving my patient. So we'll slide a backboard in, and then on your count, Monty, then we'll roll him down onto the backboard.
Okay, 1, 2, 3.
Okay. Then I'm going to secure Talmage to the backboard with spider straps, and we've got a C-collar on him that Monty put on before we log rolled, right? And I'm going to say that my patient is a high priority transport. And I'm just going to recheck your vital signs at this time, okay?
Mm-hmm.
So, Talmage, I'm going to start with your heart rate, okay? And your respirations.
Okay.
I've got respirations at about 24, so you're a little high on your respirations, and let's check out your heart rate here. Your heart rate's about 90, so you're on the high end of normal there, so that's good. Your skin CTC, you're a little cool. You're looking a little bit more pale, but we do have oxygen on you. So I'm kind of feeling like you are showing signs and symptoms from shock. You may have lost a little bit too much blood down here, so I'm going to go ahead and treat you for shock right now. And I'm going to deem that you're a high priority transport, okay? So you're already in a good position. You are starting to feel a little cool to me, so I'm just going to cover you up with a blanket, okay?
Okay.
Make sure that oxygen is on you, and we're just kind of helping you out there, okay? Talmage, I'm going to check your pupils again.
Okay.
So just close your eyes for me, and then open, close, open. Okay, your pupils are still pearl, that's good. And before I even check your blood pressure, I'm going to listen to your lung sounds, okay? Okay, taking a deep breath and exhale. Okay, again. Again. Okay, one more time for me. Okay, good. Lungs are equal and clear bilaterally. I'm just going to take your blood pressure, okay? Talmage, do you have any other signs or symptoms that I've missed?
I don't think so. There's just the leg down there.
Are you allergic to anything, Talmage?
Not that I know of, nothing except for just general allergies.
Okay. Do you take any medications, any recreational herbal supplements?
No.
Prescriptions, anything? No,
Mm-mm.
not on anything? Okay. And do you have any medical history that I need to know about?
No, I can't think of anything. I'm a pretty healthy person normally, except for today, I guess.
Except for today?
Yeah.
Okay, well, accidents happen, right?
Mm-hmm.
Okay, what was the last thing that you had to eat or drink today?
Eggs this morning.
Okay, about how long ago?
I would say that was about 2 hours ago.
Okay, 2 hours ago. Have you had anything to drink today?
No, nothing to drink today except for some water, maybe.
Okay, and can you tell me again what happened?
I was just up on the ladder. I kind of lost balance. I was, having somebody hold the ladder there earlier, but then I think it was an old ladder, and I tipped. I was trying to get the tile out, and I think it just kind of fell over.
And do you feel like you passed out at all? Do you remember the whole event?
I think I did.
I think you did pass out?
No, I think I remember the whole event.
Okay.
I'm not entirely sure.
Okay. And all right. So on a scale of 1 to 10, like how bad is that pain in your leg?
I would say it's like an 8 right now.
Okay. All right. So I'm going to take your blood pressure now. Okay.
Okay.
Okay. So I got 110 by palpation. Okay, got 118 over 80. So your blood pressure is great. Okay.
Okay.
You said you're 22,
Mm-hmm.
right? Okay. All right. So I'm going to, again, you're a high priority for patient. We need to get you to the hospital, and especially because we have bleeding controlled, but you are kind of shocky. So I want to make sure that you get checked out and just make sure that we haven't missed anything. Okay.
Okay.
So I think it's a good idea to have a doctor check you out. So I'm going to reassess my patient now. So I'm going to reassess my primary assessment, repeat my vital signs every 5 minutes because I'm deeming Talmage as a high priority patient. And I'm going to check all of my interventions. Is that oxygen helping you, Talmage?
I think it is, yeah.
Yeah. Okay. And I'm just going to reassess this bleeding and make sure that this is still under control. Looks like the bleeding is still controlled. That's good. And I might even split that leg. Okay.
Okay.
Because it's definitely like an open wound. So we're going to splint your leg too. And I've treated you for shock, and we're en route to the hospital.
Good.
Okay.
Awesome.
All right. Cool. And that's the trauma assessment.